Hi, thank you for tuning in to Global Elite Academy. If you are interested in opening up your own non medical home care agency, please go to globaleliteacademy.net. That's globaleliteacademy.net. We offer two programs. One program is that you could do on your own, at your own pace, and we will provide you with the policy and procedure manuals, and that's $2,500. The other one, the program, is we help you get the license, we help you get everything step by step, everything you need from beginning to end. And that one is it depends on what state you're in, if the state is regulated or unregulated. So it's anywhere from 12,500 to 15,500. And that includes the IHSS program and the licensing for your state. Now, if your state doesn't require a license, if it's unregulated, like Arkansas, which we're going to talk about today, the rate is 12,500. And that includes the IHSS program. Okay, so let's talk about that now. Now we're going to talk about how do you open up a home health agency in Arkansas. Arkansas is an unregulated state. Therefore, you do not need a license in Arkansas to open up a non-medical agency. But in order to open up to use IHSS patients, you have to get licensed. Now, the IHSS program, which stands for In-Home Supportive Services, in Arkansas is called the Dependent Choice Program, and is part of the Medicaid waivery system, which is that community-based program. It allows individuals to self-direct their care, including hiring family members as paid caregivers. This program essentially functions similarly to IHSS, In-Home Supportive Services, program found in other states. Participants receive a budget to manage their care needs, and they can choose who provides that care, which means if you want to have family members you want to hire, you could do that, or you could pick whatever home care non-medical agency that you want to pick to provide your care. The program, again, is called the Independent Choice Program. The program is administered by the Arkansas Department of Human Services, DHS, and allows individuals to self-direct their care. It's a Medicaid waivery program. It's part of Arkansas Medicaid waivery system, meaning it provides home and community-based service as an alternative to going into a nursing home or institutionalized care. So what does it mean by self-directed? What that means is it allows you or gives you control over your care, including hiring and managing your caregivers. You can have family caregivers. Now, most of these programs, you have to check your city because it may be different. In Colorado, I know, and Arizona, and it might be a couple of more. It might be all of them, but you just would have to check. For family, they only allow family to do 40 hours a week. But if you're not a part of your family, you could do more than 40 hours a week. all the overtime or whatever you want to do, you would go sign up at an agency, and then you would, get those hours to work for your loved ones. But again, if they're your loved ones, you can't do but 40 hours a week. Now, it says this program in Arkansas is similar to IHSS. So let's see what the difference is. While not officially named IHSS, the Independent Choice Program serves a similar purpose to IHSS program in other states. It's providing support for individuals to live at home with the help of a paid caregiver. Now, some of the things you would have to check, I guess, that says similar, it's probably, the same. Some of the things that may be different, like when you're in that IHSS program, they also have a program for children up to 18. And then they have a program for disability people. And then they have the program for seniors. So it may not offer for all three type, for disability or children or seniors. It may not offer for all of that. It may just offer for some, some, because it said it's similar. But it's not telling me what difference it is. So I don't know what the difference is. Now, but you can always check with that. When you would go to sign up, they'll tell you all the rules and the regulations that that you have to go by. Okay. So I know a guy that he's a friend of mine. He opened up an agency in Colorado Springs that do IHSS. I don't know if I told you all this before. With the IHSS and his private pay, he has more IHSS patients. He earns his gross is $25 million a year. Million. So what he decided to do was open up other agencies in other states that had IHSS. He only told me he only wanted to take IHSS patients. He didn't really care about even taking the private ones. So he opened up one I already had Colorado Springs. He opened up one in Florida, Arizona, Arizona, I think it was Missouri. Then he had Colorado Springs, and I don't remember Colorado, and I don't remember the other one he opened it up. And that's all. He said he did not want to open up an agency at a place that did not have IHSS. Because without the IHSS, it was so hard for him to get private patients. He has to really hustle, to get private patients. But with IHSS, once you sign up, your name go on a list for the social workers. And then the social workers start sending you patients right away. So you're not even marketing for your patients with the IHSS. When you get the certification or the license, they automatically send it to you. I think one lady I know, when she got her license, became approved. 2 weeks later, she got her first patient. About a week later, she got 2 more patients. And then it just kept going and kept going. And then when they get one case manager told me that she does patients like in a particular suburb of Denver, and she has a list that she put all the approved people on that list in that area. And then she doesn't give out all the agencies, you know what I mean? She just gives the agencies in her area. She gives that list to the patients. But I also know that when you market on Google and you get to the first page of Google, people be calling you because they're looking for people. They're looking for agencies that take IHSS. I used to help one of my clients, and I answered her phone in Boston, and she had, people. I was like her receptionist. I helped her, and people were calling all the time with IHSS and looking for an agency. This person I was working for wasn't licensed for IHSS, so we had to turn them away. But I'm just telling you, marketing, you can market them, and then they'll find them that way. Or you don't have to market them at all because the case manager will find out. And then I know in Colorado, when you become licensed to take IHSS patients, they put you on their website. So you're listed on their website. So if people wanted to look for an agency to take IHSS, all they have to do is go on the website and see. And it's not like, I'm sure it's constantly growing, but you're not going to go on the website and see like 100 agencies on there. Some cities you may, so I don't want to say that, but in Denver, it wasn't that many agencies on there. I don't even know, maybe about 20 agencies, and people could pick. So people will be able to go on the website and look for an agency, or you would just advertise, and they would call you and see if you took IHSS patients, or the case manager will send you the patient. So that is why my friend, because like I said, he was already making $25 million, so that's why he said he only wanted to open up an agency in those areas. So it's really worth it. I have a lot of people calling me looking for, they're looking for, wait a minute. I have a lot of people calling me, they're looking to start their own agency. And they never say anything to me about IHSS. They could be calling from Florida, Colorado, Arizona, because I help people all over the U.S. They never say to me, I want to get my license to open up a non-medical agency, and I also want to open up IHSS. I haven't had one call to say that. When they call me, I have to tell them about it. And when I tell them about it, they always say, oh, I didn't know that. Oh, yes, I want to sign up for that too. And the reason I tell you is because it's included in my price anyway. And then the other thing is that when you get your license for a non-medical agency, you are only licensed to take private pay and long-term care insurance. That's it. So if you don't get that IHSS and you have a patient, a low-income people calling you for help, you just have to turn their business away. Because number one, you didn't even know anything about the program. So that's why I decided to do this iPod, to kind of, tell people, like, when you're applying or want to open up your agency, don't forget, just don't think that low income is just going to come to you. Home care is very expensive. I remember one lady told me, and it's gone up now tremendously. So this is back in the day when it wasn't expensive. This lady told me that she was paying $10,000 a month, and that was just for caregivers. $10,000 a month. It is way over that now, because some agencies will bill like $800. If it's a 24-hour case, they might bill $800 or and over and more per day. Per day. When I had my agency, and more, remember that, and more. When I had my agency and I was billing clients between 10,000 and 15,000 a month because I collected, once a month. So you want to make sure you do the IHSS. Thank you so much for tuning in to how to open up a non-medical agency in Arkansas.